All right, and hey, guys, welcome to Breakthrough 2020. Again, I just a recap of what this station or this message or what we're trying to accomplish is about. It's really simple. People are getting broken right now. We are in a time in really in our nation's history where disruption has just been massive. And so I have been very blessed to know some phenomenal individuals, both business owners, entrepreneurs, people across multiple sectors of business in both Houston and really across the nation. And I wanted to make those people accessible in an environment that you could come get some information, but not be overwhelmed with some type of sales process, some type of, I ask a question or I seek information and all of a sudden I've got a million emails spamming me up, right? If I look at my inbox, I've got a million already today, and I don't want people to feel that level of pressure in an environment where they really just need to seek to understand. So hopefully today's episode or today's interview with my friend Art Goetze from Scoop Health is going to be driven to help you get some information about the world of medical insurance for you and your family. Now, again, some of these videos are about resources that you can use if you're out on your own, you're breaking out on your own, you've lost your job, you need some clarity. Some of these episodes are about inspiration. Some of these episodes are about business models that you might be looking to take advantage of. Some of these are about investment opportunities and things that might exist on the other side of this thing. So everybody has a chance to break through in a different way. Today's episode is really about the medical space, right? So medical insurance space. A lot of people, I've been there. When I went out on my own, I had to go get medical insurance for my own. It was a very scary place for me. I spent 16, 17, 18 years, and my plan changed every year from the provider. I switched it, called HR, made sure it was all good. I had insurance. Woke up one day, was an entrepreneur. Someone says, by the way, you got to get insurance. And oh, crap, it was a mess. And I was trying to figure that stuff out. So Art's going to give us a little clarity. And today he's going to talk to you about a special program called medical cost sharing. And she tell us a little bit about how that works. So I'm excited to share that with you. And Art, thank you so much for joining us today. We'll take about 20, 30 minutes just for you to take some time out and tell us about that. So again, Art Goetze with Scoop Health. So give us just a kind of a quick backdrop. Tell us the story of Scoop Health and really why you've made this your mission.
It's interesting. I appreciate the time and good morning. And, I used to be in the emergency room business. I actually started the freestanding emergency room business. So you can thank me for the little emergency rooms that you see everywhere all over Texas. I actually wrote the law and passed that in Texas and created that class of business. And probably the most interesting thing I learned in the emergency room business was that you spend 40 cents of every dollar to collect your dollar. Pretty amazing. And the other interesting thing I learned in the emergency room business was that 75 to 80% of the people that walked through the front door didn't belong there in the first place. So that tells you the state of healthcare, that people are confused. They don't really know how to consume healthcare very well. Insurance doesn't help when they stick a $5,000 or $6,000 deductible out between you and getting healthcare. And so really what I walked away from that experience with was that we have a really broken healthcare system. Insurance sort of corrupted the healthcare system and kind of took over. And for maybe 40 or 50 years, people have really equated insurance with healthcare. And they couldn't be further from from one another, right? There are lots of disincentives and problems that are baked into that model. But really, that's why I was so excited when I stumbled into medical cost sharing, because at its core, what medical cost sharing does is it functions an awful lot like health insurance does. You pool together enough people, you spread the risk around. You can do it with less money if you don't have to pay for the Wall Street returns and overhead of a big giant insurance company. And at the end of the day, demographics are what they are and a group is what it is. And so when you spread that risk around, the cost doesn't go up, it actually comes down. And so we love the idea. And gosh, look, I mean, lots of things have been innovated out of existence. Take Kodak, for example, right? Nobody puts film in their camera anymore. And I envision one day where people are going to share each other's medical expenses without the assistance of Wall Street and a big insurance company. And that's really at its core what medical cost sharing is about. Now, lots of people may have heard of medical cost sharing in the Christian context, right? There are a handful of them: Liberty Health Share, MediShare, Samaritan Ministries. And for 30 years, the Christian community has been sharing medical expenses. But like our founder says, Christians really don't have any unique DNA that makes them healthier than anybody else. And so we don't need or have any faith-based requirements to participate in the program. We're equal opportunity sharing. And so the bigger our community gets, the better it is for everybody.
Fantastic. And so for those that are entering, and we're going to talk about three things today. The first of which is, how's it different than traditional insurance, right? What does that work? What happens in the open insurance market for those that aren't gaining or have access to insurance from their employer anymore? What does that mean for them, right? And when they go into the market. So we're going to talk about that. We're going to talk about we're going to talk about the types of insurance that exist. Then we're going to talk about what the difference is. And the third thing we're going to talk about is, what does it mean on a go forward basis? Obviously, the medical realm has just taken a complete, it's been flipped upside down in the last 90 days. I mean, we're talking about a completely shift in dynamic as to how you're going to even receive medicine in most cases. So you can tell us a little bit about that. So first and foremost, I lost my job, right? Or I've decided to pursue my mission and I'm going to go start my own company. This is exactly what I need to push me over the edge. I need to protect my family though, because the last thing that I could afford to have happen is one of my kids or myself get sick, and then I can't afford to take care of ourselves, and all my dreams go up because I have a $50,000 medical bill or something crazy like that, right? So what does the traditional environment of medical insurance look like for an individual going out in the world?
So yeah, that's a good question. Insurance kind of falls into two baskets. One is the traditional type of an insurance policy where you pay a premium. They tell you what's covered. They tell you who you can go to because you have a network, and they put a big fat deductible out in front, $5,000-$6,000 that you pay before the insurance takes over, right? And then after that, sometimes there's a split, a sharing model. It might be 80-20, might be 70-30, maybe it's 100% after the deductible. Every policy is a little bit different. The other kind of insurance is what's called defined benefit, which is, you pay somebody. I think it's more kind of like going to Vegas, right? Because they pay you to be sick. So they don't pay the doctor, they pay you cash. You've probably seen like Aflac and some of these other plans where you pay a premium, and if you're in a hospital bed, they'll pay you $1,000 a day, maybe. And those are fine but it has no correlation to the cost of the care. It's not worried about what the bills are. It just gives you some cash, and they sell it as this is a way to maybe pay your expenses while you're down and out. So that's fine, but that really doesn't solve the problem that you just put out there, which is, gosh, what happens if I get a $50,000 bill and I got to take care of my family, right? Mm-hmm. That's the big scary part. And, that's what most people look to health insurance for. The other thing I want to talk about, what you just mentioned, is not everybody makes the decision to buy health insurance. Some people look in the mirror and they see a healthy adult, and they know the statistics, because we all inherently know we just don't go to the doctor that much. And so they take a chance and they go without. And then you go off on the weekend and you do something fun, and we all know that fun stuff is also risky. And then we add beer, and that makes it even worse, right?
Yeah, right.
And then something bad really does happen, even though we're completely healthy and we have an accident. And then we're staring down the barrel of some really bad bills, and we have to go to our family or foreclose or more of a second mortgage on the home or whatever it is to come up with the cash to pay a bunch of medical bills. So that's not a good option either, but that becomes the choice. It's kind of a binary choice now. People either go without insurance and they take the risk, because none of us get sick that often. That's the truth. The statistics will say about every 7 to 8 years, you're going to have something really bad, and it's going to be expensive throughout your life. And so those are decent odds if you want to take them, right? And so a lot of people do, especially going out on their own. We talk to small business owners a lot who say, I just can't afford health insurance for my people. And a lot of franchisors who have key people that they're trying to keep around, but health insurance, they're just priced out. And even when you do buy it, if you have if you're working hard and somebody puts a $5,000 or $6,000 deductible out in front of you, well, heck, you might as well not have insurance, because 2/3 of the things that you're going to need are going to probably cost less than $6,000.
Right. Like it or not, the inherent risk that we now take on as an insurer is only going to be that much higher. So those costs are going to get passed down to not only, well, that, and the fact that a lot of people will be in the medical space probably suing. And so all the litigious stuff that's going to come on the back end of this deal, combined with a higher level of risk that the insurer takes, only gets passed down to the business owner and to the end user, right?
Yeah, so that's interesting that you should say that. I want to dig into that just a tiny bit. We've had 30 or 40 years of hyperinflation in healthcare, and there's a simple reason why. They kick the customer out. Customers are who care about prices for everything, whether it's car insurance or getting your new tires or healthcare. But there's been no customers left. The only people in healthcare that worry about prices are hospitals and insurance companies, and both of them benefit from rising prices. And when you introduce cash payment models into healthcare, just like everything else in the world, guess what happens? Prices go down, quality goes up. Because I have to compete for your business as a provider. I have to compete on price and quality, just like any other business in the world.
Right.
And so when we introduce this cash model called medical cost sharing into the equation, we find that the cost of healthcare drops like crazy. And what we're seeing is a ton of cash options popping up on the scene. For example, there's a surgery center, the Texas, I can't remember the name of it, up in Austin, Texas Free Market Surgical. There's another one in Oklahoma City called the Surgery Center of Oklahoma. You can go to their website right now and see the cash drive-out price for about 1,500 different surgical procedures.
Wow.
And it's cheap. And it's not bad quality because the doctors are competing for your business. And so we see a dichotomy setting up here of insurance-based hospitals and practices that rely on those big, fat, bloated insurance billing procedures and what have you. And then on the other hand, you walk into the doctor. My daughter needed an ACL replacement. She walked into called the surgeon's office and got a cash price. We submitted that to the cost-sharing community. They said it's a great price. We did a second opinion that the community paid for, and she, from end to end drive out price for her knee ACL replacement, she paid $250 and the community paid the rest.
Wow, that's a great success story. And I think you just hit it. As medical becomes more free market, as opposed to this is your choice, like it or leave it, there will be an improved opportunity there. So let's shift gears for a second. Let's talk about the difference, right? So I'm accustomed to, and I'm just sharing my own lifestyle, right? So what I've always done, right? I have an insurance amount that I pay each year. In my current world, we use my wife's benefits because she's employed through a company, and they have a pretty overall, right? They're getting a better value from the things that I pursued individually. And in that process, we pay a certain monthly amount. We both have a deductible. Typically, I know to call and make a phone call to go out into the world to, I know, okay, does this person fall in network? I have a PPO, right? So can I go here? Can I go there? So I have to make a couple of preemptive phone calls, or even when I was doing my neck issues and stuff that I was going through, I had to learn. I learned one hard way the first time is the first place I went that the ortho referred me to get my images done was not insured. So I had to learn that the hard way. I had to fight those guys a little bit because I was at an insured ortho, but they sent me to an uninsured person to do my lab.
Or they probably owned it too.
Probably. So in that process, I said, okay, wait, hold up. I thought this was all under my insurance. And so I had to find that out the hard way. And I negotiated a few things because of that lack of clarity. That being said, it wasn't fun. Right. And then so at the same time, I'm accustomed to being out of pocket. I know I have a certain amount. I think last year we hit our deductible because of my neck problems. That being said, once it was over, right, then the deductible was met, and they stepped in and helped out with a lot of the other things that I was dealing with. So I think a lot of people know that model. I just kind of described it. maybe you can just tell us more about your model, right? Tell us about what happens in medical cost sharing.
Sure. Well, you opened up a whole lot of can of worms with that description there. Number one is, in the age of Google, why does anybody need a network? You know, networks were created back when Blue Cross, we were looking for doctors in the yellow pages before you were born, Jason. And, you know, we actually needed help finding doctors, and Blue Cross was good at finding doctors, but that kind of got perverted. You know, it sort of turned into something more where Blue Cross gets to control us. In a cash model, you go to any doctor that you want, because they all have cash prices and they all have insurance prices. So that's the first big difference, is that we're cash paying patients. You know, the other thing is that, you know, albeit some doctors actually, you know, I don't want to throw the profession under the bus. I think for the most part, docs are great. But when you get into a fee for service world, things happen, right? Diagnoses, treatments, what have you. When you're a doctor, and you make more money by doing more procedures or scheduling follow-ups maybe more frequently than they're needed, because every time somebody comes into the office, the insurance company's going to pay me $250. You come in, you wait for an hour, you know, you see my nurse for 15 minutes, I walk in and, you know, salute and walk back out the door, and I make $250. Wow, it's a bargain for a doc. So the system is set up, the whole fee-for-service system is really set up to work against the patient. But they cloud it with an insurance company and a big deductible. You know, your deductible is the other thing you brought up that really we need to talk about. Deductibles. Now, have you ever heard anybody say, hey, I met my deductible in June, and the rest of the year I'm going to get all kinds of health care done because it's paid for now?
Mm-hmm.
Wow, what a concept. In our world, we don't work that way. We have what's called an initial unshareable amount, and it's tagged to the incident, not to the year. So if somebody gets a diagnosis of a cancer that's going to take 2 years to treat, they pay that initial unshareable amount one time. In my case, it's $500. It doesn't matter what happens to me. I pay $500 towards that incident, and 100% of the rest of it is shareable with the community. Whether it lasts a weekend in the ER or 2 years worth of treatments, I pay it one time, which is as it should be, tied to the incident as opposed to the year. The year is arbitrary. Same too with open enrollment. You've heard of that, right? You can only enroll in a 30-day period of the year. Why? Why is that? I don't know. I can't explain it to you, but all I can say is that people enroll in our program all year round. So there's no barrier to entry in that sense like there is with insurance. Insurance, when you sign up, what happens is they call it a transfer of risk. When you pay that premium, you also transfer your risk, just like car insurance. They tell you which body shop to go to, right? Well, when you transfer your risk to a health insurance company, they tell you which doctors to go to by the network thing. And if you dare to go outside the network, what do? They penalize you. They penalize you for going to the doctor that you want to go to. That doesn't make any sense. And in a cost-sharing world, you go where you want to go. You get the care you want to get. In the case of if somebody wanted to go to the Surgery Center of Oklahoma to get a hip replacement because they were saving $10,000, the community would probably pay for their plane fare and their hotel to get that done. If they were saving the community money, why wouldn't we do that? Why wouldn't we incentivize good behavior? And so that's what this is all about. You know, it used to be that we needed an insurance company to help us find care, help us find doctors. And now in the day and age of the internet, we don't need that anymore. We help our members find doctors if they need to find a doctor. We help them find anything that they need related to their health care. For example, the scan that you got, I would have sent you to Green Imaging, and I would have said, Jason, get online in Green Imaging. You can have a CT scan for $350 1 hour from now near your house. Promise. That's how, because Green Imaging went out and they aggregated all the excess capacity in every scanner they could find and said, hey, if I deliver you a patient in the next 2 or 3 hours and you have an empty scanner, how much would that cost? And most of the centers will do anything to get a little extra cash in, and so they slash their prices. Insurance might still be paying $2,000 for the same scan that you can get for $300.
Wow.
On an on-demand. And this is what we do. We help people be smart consumers of healthcare. Instead of turfing control of your healthcare over to an insurance company, which happens when you transfer your risk, you transfer control and choice to the insurance company. And that's not consistent with our health, nor is it consistent with the way we consume any other product or service in our life.
Got it. And so, and I think those are some great, you've articulated the objective of why I wanted to do this, which is just bring something fresh to somebody's perspective and give them another option. So I think as we look to transition out of this interview, the thing that we'll talk about is what does it look like going forward. Before we jump to that, I do have one question, right? So all of that sounds great, right? And so, that being said, what are the potential risks, right? What are the potential, where's the disruption here, right? The old saying, if it's all roses, it might be too good to be true. I'm sure there's some people scratching their head going, is this too good to be true? It sounds too easy. Where do you see risk inside of this as opposed to the traditional environment?
It's funny that I get the too good to be true question a lot from people, because this does sound, it's just like one of those, wow, really? Yeah, because it just makes so much sense. And the happy truth of it is, it does make sense. Just like Uber makes sense, right? Why would you call a yellow cab? You wouldn't. Why don't we put Kodak film in our cameras anymore? Because we got digital, right? It just makes sense. Medical cost sharing is just an innovation in the space that's solving a very acute problem in our society. We waste a lot of money on insurance company profits. If you don't believe me, you're a stock guy. Go look at the charts for United Healthcare, Aetna, and Cigna, and you tell me what you see. They're like this. And the reason for that is just as plain as day. They make profits on sickness. Medical cost sharing doesn't make profits on sickness. We're community based. And once you're in the community, what's good for you is good for me. We have the same rules that apply the same to everybody in the community. If you like the rules coming in the door, awesome. If you don't come in, don't join, don't participate. It's fine. We have things like pre-existing conditions that we keep at the door. We let them come in over time. If somebody needs hip surgery, they can't come into the community and get the hip surgery tomorrow. They have to phase in, right?
Right.
So we take care of risk that way. We age band. So I'm going to pay more than you are because I'm older and because I'm going to have a higher incident of claims than you are. We choose when we come in, how much risk do I want to take in that IUA, that initial unshareable amount, my out-of-pocket, $500 I picked. I could have picked $5,000 and got a lower monthly sharing amount.
Right.
I chose 500 because it makes me feel comfortable. But if I'm super young, super healthy, and I know it's just going to be something really bad, and I've got $5,000 sitting in the bank that I can, count on, I might pick $5,000 as my sharing amount. I'm sorry, my out-of-pocket amount, and then pay a much lower premium.
Gotcha.
I'm not allowed to use the word premium. It's a sharing amount.
I hear you. Yeah.
So we've done a lot with this model to really try and take all there's nothing mysterious about this. It's as transparent as you can possibly imagine. It takes me about 25 to 30 days to get reimbursed for a bill that I submit to the sharing community. That's before it's due at the doctor's office most times.
Well, and I think in most cases, the reason why people don't switch to most things, oftentimes, even when they do sound good, is skepticism. And so I know, speaking specifically about friends who I've watched, they pass up things that are no brainers. And I'm like, why are you not doing that? And it's because they literally are in their head. They're going, well, but, it's easier me, I'm uncomfortable here. Right. And so And that's, again, part of the reason of this show, because maybe it's time for you to not be comfortable, right? Maybe you don't have a choice right now. Maybe you have to figure out some things and weigh options that don't exist or that you didn't have to look at before. And that's usually the case, right? People, when you pivot and your hands are tied, sometimes you have to get outside of your comfort zone. And this is new. It's fresh. It's something that maybe is just hitting the marketplace. I know I've known you for a little over a year, and you've been hard charging towards your mission. So because we're running out of time, I don't think we're going to get to cover a whole lot about what it looks like in the future. I think your story of what you've shared has really been enough to help people understand there is something to be said in medical cost sharing. And so before we wrap up with how people can reach you and connect with you, I want to first of all thank you for your passion. I know you're driven towards that. I want to remind anybody watching this and everybody that I interview, I'm bringing on people from direct sales companies. I'm bringing on, I'm not getting kickbacks on this thing. This isn't from, I'm not here signing off on Art's deal. This started and originated. I remember talking to Art a few weeks ago, and we were just checking in. I picked up the phone and checked in. I said, "Hey, I saw him." We chatted back and forth on a post on Facebook. It's the beauty of that thing. And I said, "Man, how are you doing?" We hopped on the phone. I thought about the disruption going on, and I said, "Man, maybe some people need to hear about what you're doing. We should let me think about how we'll do that." And then this thing came to me. So just want to make sure I emphasize that for anybody watching, because it's not biased. This is not a biased deal to help you go do what Art's doing. It's an opportunity for you to make educated decisions on your own, for you to go out and weigh all your options, but know that Art's a resource. He's somebody, I actually know a personal friend who went through some things and was using Art's service, and they raved about it. So that's one of the things that made me comfortable going out here and bringing it, because that's how it operates for me. I'm a relationship guy. My brand is me and my desire to serve others and the people that I stand behind, the connections that I make. And so I wanted to make sure I made you available to folks. So with that being said, how to name of the company, how do they reach you if they need any help? Just let them know. And then that's also, if you want to talk to me, I'm happy to get you connected with Art, however that works. So tell us a little bit about how people can reach out to you.
Yeah, perfect. I will. I want to say one last thing, and that is that, innovation sometimes gets forced upon us, and other times we have to find it ourselves. This innovation is really neat. We've had the Christian community out there doing it for 30 years to work the dents out. And so not often that you get an innovation that seems so brand new and so cool that somebody else has been figuring out and working the dents out for 30 years. It's like magic. It's so cool. It's almost like it was getting prepared for us to bring it to the rest of the world.
Well,
so
this is one of those moments.
One of those, right? We're scoophealth.com, and there's a lot of information on scoophealth.com. And of course, I can be reached on LinkedIn or any other of the channels that somebody wants to reach me through it, or it's art@scoophealth.com. So everybody has questions. Nobody gets this right out of the gate and goes, "Oh, sign me up." Everybody has their own personal issues, stories, questions, needs, whatever, and they want to see, does this fit my circumstances and my family? It's awesome for small employers. It's awesome for gig workers, home-based workers, people like that. I want to just help people because I see people suffering, paying way too much for insurance that just doesn't work for them anymore. And that's why I'm doing this, is I love helping people. I love the story about that person that you and I both know that was down and out and really suffering, and they were staring down the barrel of some huge bills, and we solved that problem for her. And she's very appreciative, and it's just how this works. It wasn't like it was anything special, but it felt special, but it wasn't. It's what we do every day.
I can say it was in the conversations that I shared with that person, it really felt like it was that thing that gave me the confirmation to say, yeah, I need to reach out to Art and have a conversation so that I can help others that need potentially are in this place. And so as a reminder, guys, Art, thank you. Breakthrough happens from broken situations, right? And so everybody I'm going to bring on in the next 30 to 60 days is really centered around helping you sort through the clutter, find some clarity, and then go do what you're called to do, whether it be spiritually, mentally, physically, whatever that is, there will be people a year from now who got destroyed because they simply said, this thing's beating me. And there will also be people who will embrace it and say, this is the thing that I need to break through. So I appreciate you guys. Thank you for being a part of my network. I want to continue to share great stories with folks. If you know somebody who needs to share their story, make them reach out or have them reach out to me. This is not a profitable driver or anything like that. So this is solely communication and sharing the good word. So we hope to see you out there. Thanks a lot, Art. You guys have a good day.